Okay, so Dr. Ide, or better known as the father of corticobasal implantology. Tell us please, why did you think about this technique and to start with it?
When I started with implants in 1990s, there was no bone augmentation, so the patients didn't have enough bone. There were not so many implant systems available like today. I was lucky to find disc implants, these French implants which were put from the side into the bone. So I was able to treat patients with low bone, and I was able to treat in immediate rolling protocol. So this is how it all started. And later, in about 2004, the corticobasal implants were developed and produced by Ide Dental. And from then on, I was able to use those designs, and I used less and less the disc implants. So this is how it all happened.
Good. And when you started to use this technique, how did you think the dentists and the public would accept it as a new technique that is a little bit far from the traditional way of doing things?
Yeah, in general, in the 1990s, implants, all implants were not so well accepted. The acceptance of implants started when the universities were starting to do it or paid to do it. And before this, implants were not accepted by, let's say, by the colleagues and by the universities. And they were only accepted by the patients, actually. This was a different time.
Yes, exactly. And how do you see the future of corticobasal implantology compared to other techniques?
Well, I would say that the two-stage implantology is an outdated method, or this method of osseointegration will lose market share, I would say, or will disappear, because it doesn't fulfill the hopes and the promises. Patients don't want to wait for implant integration. Patients, if they decide for the treatment and if they have the money, they want a result. And this is what we can give them within a few days with the corticobasal implant. So that's why I think this is, it will be much more accepted compared to bone augmentation and two-stage implantology.